Hello, my name is Eben, and I'm in grade 7.
Hi, my name is Sanara States, and I am a fourth-year psychiatry resident at Dalhousie University.
What does a psychiatry resident do?
So a psychiatry resident is a medical doctor who has completed their 4 years of medical training, and they are now doing their specialty training in their field of specialization. In my case, it is psychiatry. So what I would do as a psychiatry resident is assess and diagnose and treat people with disorders of the mind, their emotions, their behaviors, and that sort of thing.
What do you need to do to become a psychiatry resident?
To become a psychiatry resident, I went to university and completed an undergraduate degree, majored in biology and psychology here at Dalhousie University. And then I applied to medical school and took the admissions test to get into medical school and completed my 4 years of medical school training. After completing medical school training, I then started my specialty training program, which is 5 years here at Dalhousie in psychiatry.
What is your favorite thing about being a psychiatry resident?
My favorite thing about being a psychiatry resident, I would say, is the people that I get to work with. And what I mean by that is the patients that I see and the conversations that I get to have with them, and the privilege that it is that they are willing to share with me the most challenging, most vulnerable times of their life. And I'd say that's probably the most rewarding part of my job, is getting to just see them get better and see the recovery.
What made you choose this job? Did you know anyone who was a doctor when you were growing up?
When I was 6 years old, my mom took me to see a pediatrician, and that day was the first day that I've seen a physician who was not only female but also a black female who looked like me. And it was the first time that I realized that that could be something that I could achieve one day in life. And then as I got older and I continued to still want to be a physician, I started to work with youth here in Nova Scotia, African Nova Scotian youth, and I started to get to know the challenges that they were facing, both academically and then also mentally, in terms of their mental health. And I noticed the gaps in the mental health system and the challenges that they faced in accessing care and accessing help, not only at a systems level, but also with them not feeling, them having a lack of trust, or not feeling as though the person that they went to for help was going to be able to help them. And so I think that also made me want to be that person for them, and really pushed me even further to become a psychiatrist. And then the last thing that really solidified my decision to do psychiatry is when, during my final years of medical school, my mom became ill with cancer. And during in the final years of medical school, you're rotating through a bunch of different rotations, a bunch of different specialties. And what I found with psychiatry, no matter how terrible I was feeling or how difficult things were getting in my personal life, I always found joy going to work when I was seeing someone in psychiatry, seeing a patient in psychiatry. I always felt as though there was something I could offer, I had purpose, and that was when I knew that psychiatry was a job that I could do for the rest of my life, no matter what I was going through. By the time you grow up, I do think there will be a lot of jobs available for doctors. Medicine is a growing field, and particularly in psychiatry, we in Nova Scotia do have a shortage of psychiatrists, especially in rural Nova Scotia. So if psychiatry or mental health is something that you're interested in, I strongly encourage you to consider this career as an option. Advice that I would give to someone your age who's interested in a career in health is to first and foremost believe in yourself, and try not to compare yourself to your peers or to other people around you, because everyone learns at a different pace. And that doesn't make you any better or any less than the person next to you. So my number one piece of advice is to believe in yourself, and also to just reach out and ask for help when you need it.